So we are going to be doing some injections for masseters. What this does is if patients are grinding or clenching hard, that masseter muscle gets very irritated and it bulges, and it also affects the TMJ, temporal mandibular joint. So go ahead and clench for me really hard. So you can see it. We've been doing this probably like our third or fourth treatment. So you can kind of see where the muscle lies. So I'm gonna mark it so you get an idea of where it is. Relax for a second and then clench again. Good. So it's kind of like in this little area. Now, when you are doing the injections, you don't wanna go higher than that tragus. So you wanna keep it within this range. So we kind of keep it right in there and then relax and then clench one more time. Perfect, yeah. So right in there. So there's different ways you can do this. As long as you're in the belly of the muscle, there's no wrong way. I like to do a upside down triangle, so I tend to do a 3-point injection. You could do like a die, so like you could do a 5-point injection. So it's really where they get the most release, and you know, you'll see when I do the injection, I also like to rub it around so it does spread a little in that area within that muscle. So I'll do a 3-point injection. And I have my product all drawn up. Let me just clean her with some alcohol. Perfect. So we're using, it's all botulinum toxin, whether it's Botox, Dysport, Xeomin, Jeuveau, the new one, Doxify. In this case, we are going to be using Xeomin. And I mix my Xeomin with 2.5 cc's of saline. So go ahead and clench for me. And go ahead and relax. And then clench again. I like them when they're contracting. Sorry, yep, good. And I can feel that pressure from that muscle really release. Okay, and then clench again. Okay, and relax there. So every injection point in this case, I'm doing around 4 to 6 units.
Do I clench or not clench?
You can clench, yeah. Clenching is good if you can. Okay, clench again. And then one last one right here. 1, 2, 3. Good. Okay, and then what I also like to do if we are injecting that masseter muscle, see I rub it around. I also like to come up here because you got to remember that temporalis muscle is connected to the masseter. So go ahead and clench for me really hard. Clench down with the teeth, yep. And you'll feel a little tension all the way up here, and then relax and then clench. Okay, so there it is. That's her temporalis muscle. So I'll do a little clean here with some alcohol, and just to kind of relax that little pinch in there, I'll throw another 4 units in there. Perfect. Okay, that gives her a lot of relief. All right, and that's what goes into injecting for your masseters for TMJ. Hope that video helped.